I continue to be intrigued by the number of papers published about measurement of platelet inhibition by antiplatelet agents. Yet another report just appeared in Lancet, the RAPID Gene trial. This tested bedside genetic testing for the CYP2C19 allele. This allele is a common genetic variant that affects clopidogrel metabolism and antiplatelet response. The researchers used a bedside genetic test to identify carriers of the CYP2C19 allele and aimed to assess a pharmacogenetic approach to dual antiplatelet treatment after PCI. Carriers of the CYP2C19 allele were given 10 milligrams of prasugrel, and non-carriers were given 75 milligrams of clopidogrel daily. The researchers wanted to see what proportion of CYP2C19 carriers still had high on-treatment platelet reactivity after 1 week of antiplatelet treatment. None of the carriers had high platelet reactivity compared with 30% given standard treatment. Their conclusion is that point-of-care genetic testing can be done effectively at the bedside, and treatment of identified CYP2C19 carriers with prasugrel can reduce high on-treatment platelet reactivity. Now, it's handy to have a bedside test to measure anything, but the CYP2C19 gene? Here is the clinical part of the story. In the European Heart Journal, researchers report on a subset of patients from the KARISMA trial who consented to genotyping. This report of almost 5,000 patients tells us that there was no relationship between CYP2C19 status and ischemic outcomes in stable patients treated with clopidogrel. However, clopidogrel-treated patients did have a significantly lower rate of bleeding in carriers at 36 versus 43% in non-carriers, suggesting less antiplatelet response. Although several prior studies have emphasized the relationship between CYP2C19 alleles and efficacy of clopidogrel, this study of stable patients does establish a potential link with reduced bleeding complication, but no link with ischemic outcomes. Likewise, the CURE trial found no effect on clinical outcomes. My conclusion is that this is all interesting science, but not yet clinically relevant. I'm Peter Block, and this is a CardioSource Heart Minute.